So the role of the speech-language pathologist in the MAiD team varies depending on the patient, but in terms of patient care, the SLP is really involved with those patients that have significant communication impairment. For many of these individuals who are seeking MAiD, they have difficulty with their communication, whether that be difficulty understanding or difficulty expressing their wishes. So the SLP tends to become involved in a MAiD case. It can often be right from the point of triage, where the patient or their family member is talking with the nurse doing the triage, and there's some indication that there's difficulty with communication, whether that is in the past or currently. And at that point, the nurse doing the triage or the physician will get in touch with me and let me know that there's a patient where there might be some communication concerns. And then I'll do a bit of a chart review, get a sense for what the issues are, and then we'll set up kind of an individual SLP assessment with just myself and the patient and or family members and caregivers. And we'll look to kind of get a sense of overall what their communication impairments look like. So what are their strengths and what are their weaknesses? And we focus both on their comprehension and on their expression. Just because someone has difficulty with comprehension doesn't mean they can't understand. It may mean that they just need supports to understand. So I look to see, what are their abilities, and if I can support them with certain strategies, or if they have certain strategies they're already using to support their comprehension, what are those and how can we use them effectively? And then the same for expression. So we look at which strategies or supports they have in place, how we can use those effectively, and if there is something lacking, if there is really an area of struggle that hasn't been dealt with, then I work with them to try and to solve that problem. The SLP will then come to the MAiD team assessments and participate in those assessments. The role there of the SLP is to act as something called a communication intermediary, or a CI. And we think of the CI as something like a language interpreter. So often family members act in that role for patients, or caregivers act in that role. So the patient will say something, and because the family member or caregiver knows their strategies, they'll then interpret for that patient. But it's really important that the family and caregiver are there in those MAiD assessments, not as the interpreter, but as the family member. It also allows for the patient to be alone with the MAiD team, which is a requirement for MAiD eligibility. And so the family member or caregiver can leave, and the SLP remains present to act as that communication intermediary, so that the patient can rest assured that, their message will be communicated to the team. They don't have to worry that because it's difficult for them to communicate, they won't be able to get their thoughts across. Just because you have difficulty communicating your wishes does not mean that you cannot be eligible for MAiD. So long as we can establish a consistent way and a reliable way for us to communicate, then we'll take whatever time we need and use whatever strategies we need to help the patient communicate with the MAiD team. I think it's a huge relief for a lot of these patients in terms of having confidence that their message will get across, in terms of allowing their loved one to just act as their loved one. It removes the pressure from their loved one or their caregiver. It removes that burden and just allows them to talk. It's not effort-free, there's no question. Unfortunately, for a lot of these patients, just communicating their message takes a huge amount of effort. And in this context of MAiD, where there's a lot of emotion wrapped up in it, I was going to say it's doubly hard, but I don't think that quite covers it. It's hugely difficult for them, but at least they know that their loved one doesn't have the burden of having to do that, and I try very hard to communicate to them that they can be confident that we will make sure that whatever their message is, we will take the time to get it across to the team and to anybody else that they need to. A huge part of the suffering that they experience is not being able to communicate in the way that they would like to. And for many people, it feels very much like that means they can't be themselves. They can't be who they are. And that is I mean, I think for many people, if you said to them you can't be who you are anymore, that suffering for many people is intolerable. So I might say, is there anything that we can do differently with that person's communication so that it improves their quality of life, so that it is easier for them to make that joke or for them to understand? Do they just, do they need to see an audiologist, or do they just need a voice amplifier? Is there a basic communication or a more complex communication scheme that we can introduce that allows that person to really regain part of that sense of self? The SLP's role in terms of assisting and supporting the family and the patient, I think, is twofold. Initially, our role is to help that patient feel that we understand their communication needs and have a good understanding of who they are as a person. And then our role is to support that patient in communicating their thoughts, their ideas, not just their needs and wants, but what comes behind that. The other role is to hopefully remove some of the burden from the family member or the caregiver in that role as sort of interpreter or communication support. Because in the MAiD Team assessments, often that family member is also playing a role, just as they should, as a partner, as a parent, as a child. And we want them to be able to be in that role and have the SLP act as that communication intermediary. The SLP role in terms of supporting the MAiD team is a little bit different than the one we play in terms of supporting the patient, but perhaps parallel. Our job in supporting the MAiD team is basically to help them feel like they can do their job in the way that they know how, despite the patient having communication impairments. So we want the team to be confident that the patient is understanding their message and that they as a team are receiving whatever that patient's message is. The other really important piece is that because for eligibility for MAiD, the physician needs to spend time alone with the patient, that can be a very stressful situation for the patient and for the physician if that individual has a communication impairment. And so I think having the SLP there can go a long way to making both feel really confident that the messages will get across in that environment where a caregiver who doesn't know, or where a caregiver who knows the communication strategy isn't present, the SLP can then act to provide that link. I think something that as an SLP, and I think many SLPs hold near and dear, is this idea that we have a responsibility to help those patients who have difficulty communicating be heard, because I think so often they're not. I think so often when individuals don't know them or aren't familiar with them, they are just dismissed as, oh, they're just mumbling, or, oh, no, he can't talk, or, no, he doesn't understand. Like, don't worry about it, he doesn't understand, just tell me. And I think, each one of those times that happens, I think it's painful for individuals with communication impairment. And so I think it's really crucial that in this sensitive and emotional time, that they don't have that experience, that they can feel heard and confident that they're being listened to as the patient.